the adrenal gland. The adrenal gland, many people understand as very important, as one of those foundational pieces that make up our health. Our energy, stress levels affect that adrenal gland. And, you know, over the years, you know, I've told you guys this many times before, but I started out in functional medicine and really have moved from that into what I call synergetic lifestyle medicine. And before, when I was doing functional medicine, I did a ton of testing. And so when it came to adrenal gland testing, we did saliva tests out over the course of the day to see the circadian rhythm of the cortisol up and down. That got matched with a DHEA adrenal hormone output to give us a picture of how healthy and how optimal that adrenal gland was functioning. Well, I don't very often do that test anymore with synergetic lifestyle medicine, but there are foundational tests that I still do, and testing for the adrenal gland fatigue or overdrive of the adrenal gland is still part of that. However, we don't send out to a lab to do it. We do it with what's called an orthostatic blood pressure test, okay? And so this is a easy test that's done with an arm. I like the one that goes around the arm versus the wrist, that you can do at home to kind of track and see how your adrenal optimization is going, to get an idea again of, is your health momentum headed in an overall healing direction, or is it still dragging behind? So let me tell you how this works, then I'll show you how to do it, and then we'll talk for just a second about how to strengthen the adrenal gland. So the adrenal gland pumps out different hormones. Cortisol, which you guys probably have heard of, is probably the most popular, aldosterone, epinephrine, norepinephrine. And part of the adrenal gland's job is that when we move around in space, sitting to standing, you know, acrobatics, right? Most of us don't do acrobatics, but the thing that stabilizes people is in part that adrenal gland. It pumps out hormones when you move from up to down or around that constrict the cardiovascular or vascular system for just a moment to stabilize you, and then once you're stabilized, that lets up. And so we can use a blood pressure measurement from laying down to going up to see how much hormone the adrenal gland is able to move out in that moment to constrict the vessels, and get an idea of how healthy that adrenal gland is. Because if you're not getting enough stabilization when you're moving around, what happens? People get dizzy, right? It's very common. That's one of the most common indicators of adrenal fatigue, is you get dizzy moving around. It means that the adrenal gland is not pushing out enough hormone to squeeze the vascular system gently to stabilize you while you're moving around. Okay, so that's the physiology of that. How you would do this test is to put the blood pressure cuff on, right? Now, this test you're gonna find is not only, oh, what have I done here? Okay, so put yours on right. Okay. All right. I hope you're laughing with me. All right, so you want to make sure when you do a blood pressure test that you don't really want a sleeve in it or something like that. Bare arm is best, and your tube should be coming down the center of your arm where that artery is. Again, I like the arm cuff for this test better than the wrist cuff if you are going to test it. So all you're going to do is lay down, and you're going to take your blood pressure, okay? You want to be relaxed. You might even lay down and rest for a minute or so until you take that blood pressure so that you're stable. However, you're going to jump up once you get that number and take it again, and you want to take that number right away. So once I've got my number, I'm gonna stop it, I'm gonna jump up, and boom, I'm gonna take it again, okay? Now, when you get your 2 sets of numbers, you're gonna compare the top numbers from your laying down test to your standing up test. That top number should go up 10 to 15 points. If it doesn't, you are experiencing some type of adrenal fatigue that needs to be supported. So here's your numbers. My top number right now is 85. So that number needs, my first number needs to have at least been 75. That's a skewed test. My blood pressure is not 85, but just to give you an idea, I wanted to show you how you actually do the test. So I'm going to say it one more time. Your top number, which is your systolic number, should go up 10 to 15 points. So if it starts out at 85 laying down, when you pop up, it should go up to 95, right? Or 100. That's normal. Now your body's going to settle down and your blood pressure will drop back down to where it's normal. This is not a measurement we're doing to actually check hyper or hypotension, right? Do I have high or low blood pressure? That is shown in the number within itself. It is a comparison from laying down to getting up that tells us about the health of the adrenal. So even if you have high blood pressure, like, you know, let's say you're on blood pressure medication and the top number is 150, it should still go up to 160 briefly until your body stabilizes, and then it will drop back down. So whether you have high blood pressure, low blood pressure, with going down to standing up, you want that number to go up 10 to 15 points. Now, what if it goes higher than that? That's hyper adrenal function, and what causes that? Stress mostly, right? Too much cortisol being pumped out in relationship to stress. I'm going to tell you one other reason behind that as well. But what will happen with people who have over output of the adrenal hormone, primary cortisol, they'll drop down over time, many years, go through a period where everything looks normal, on their way to adrenal fatigue, okay? So if we take this test into consideration with our other foundational synergetic lifestyle medicine tests, which you can see in other videos and also on the brainbodysessions.com membership site, all of this information is packed in there for you guys so that you can easily review it at any time. So let's talk about if your number went too low, it didn't go up 10 points, or it went down even further, right? That's adrenal fatigue. And so let's talk briefly just about how to correct this. So now I'm going to tell you what I'm getting ready to say. This is educational purposes only. You guys know me. I strongly feel that you need to work with somebody who's educated in this information if you have something going on with your body, so that they can help guide you through these systems. Having said that, having the information is important because you can begin to teach yourself about these things, and with the help, when you need it, guide yourself into a synergetic lifestyle that will let you literally heal younger instead of older. So what is causing this adrenal stress? When we think about high cortisol, which is that hormone that the adrenal gland is pumping out when the body calls on it, I want you to think of 2 types of stresses. One is emotional and physical stress, right? That the high impact living, high stressful emotional situations, not sleeping enough. All of these things ask the body to push out more cortisol and take us from hyper adrenal activity then to normal, and then eventually to a fatigued adrenal gland in the body. The other thing is imbalance of your sugars. And I know you guys hear me say this often enough. You think that I think, you know, if you trip and fall, it's because you're eating too much starch. But think about this for a second. High cortisol and the hormone insulin. Insulin is produced when we intake starch, anything that's going to turn to glucose. The body makes insulin in order to take that glucose into the cell. Well, cortisol from the adrenal gland and insulin run side by side. When your insulin goes up, your cortisol goes up. And when your cortisol goes up, your insulin goes up. So another lifestyle consideration, again, is diet variation, where we're measuring and monitoring our individual needs for glucose. So that would be a bottom line starting place, because I'm going to tell you that herbs will help. Herbs like ashwagandha, Siberian ginseng, holy basil, licorice, maca. All of these are what are called adaptogens, and they're going to support your adrenal gland, whether it's too high or it's fatigued or it's on its way down. Okay, so I do recommend those. However, taking a supplement is not going to correct the reason that your adrenal gland got blown out in the first place. Okay, so that's where we want to come back to one, stressful lifestyle, meditation, exercise, breathing. We must do something to reduce the stress in our life. And then the other player with that is reducing excess glucose and insulin in the body to make that go up as well. Okay, for you brain body members, your brain body session for the adrenal gland is under specialty sections in the membership site. It's the HPA axis, hypothalamus pituitary adrenal axis. That is a brain correction. The brain has all the healing power within, and that session is designed to heal your adrenal gland signaling, thereby heal your adrenal gland. So you want to pull that in. If you've got this test that's off, you want to be doing that session in the membership site often, like 3 times a week, kind of often. And I've seen people that have been really off in their orthostatic blood pressure test and dizzy and not feeling good at all. I've had them do it 3 times a day when they're having that kind of an acute episode. Then they got better, right? And then we backed it off to 3 times a week. Then they got even better, and we backed it off even more. But you can use this test. You don't have to guess where you're at. Let's take the guesswork out of it and get real about where our health is at. So if you don't know what the Brain Body membership site is, I invite you to go and check it out. There is a 7-day free trialship membership that you can go in. Just go to brainbodysessions.com and everything you need to know is there. All right, see you next time.